Our next presenter is a graduate from Tufts University. She's been practicing for 27 years, and so she's been using our digital system for the last 10 months. She just joined us at Glidewell. I really admire her enthusiasm and openness to embracing new technology. Please welcome Dr. Jinny Bender.
Thank you, Dr. Chi. On the heels of Dr. Justin Chi and Dr. Michael Buck and Dr. Zant, our mill can do so many things, and I would like to talk about camouflage now. You saw a few cases. This material option has so much versatility, and it does not need an oven. No oven weight. So what we have are 6 material options with our mill, and with camouflage now, it can literally turn into many things. It can turn into a full coverage crown, an inlay, onlay, and that beautiful veneer that Dr. Chi showed you earlier. How many of you enjoy doing posterior direct composites? MO, MOD, MODBL. You know, that's some of the hardest dentistry that we do. I feel like we should charge more for that than versus a crown. But now that we have this milling system where you can make a customized restoration for the patient, it makes it so much easier for us. So some of the objectives are to understand what exactly is camouflage now, the indications and best practices for conservative dentistry, preparation design that will best suit this material, and how to apply techniques for digitizing the clinical workflow for a single visit. And also, very important, understanding the bonding protocol, cementation protocol for this material. So camouflage now is a nano hybrid. It's 80% ceramic, 20% resin. And what that means is it's more ceramic. You can charge out for a ceramic crown, but it has the benefits of resin. The strength is about 193 megapascals, and what that means is very similar to tooth structure. So it's very kind to the opposing dentition when you polish it nice. The milling time, this is the most important thing for me. It's less than 10 minutes to mill. So you can do all these things, the full coverage crown, inlay, onlay, veneer, in less than 10 minutes. And there are many shade options, 7 Vita shades, 13 total. There's a high translucency and a low translucency. You have a lot of shade options. What I love personally about this material is that it's, first of all, lightning speed milling, very accurate fitting, and color stable, durable, stain resistant. Patients love it. This is a personalized, custom-made restoration for them. They like the fact that you can do this in the same day. They like the fact that they don't have to wear a temporary. And they like the fact that they don't have to be numb more than once for a second visit. So speaking of patients who don't like to be numb, this patient, Ty, is a very anxious patient. If there's any patient who would be best for same-day dentistry, would be Ty. He does not want to come back. He wants to get it fixed that day. So when I look at his tooth number 30, he's got some recurrent decay. He's left that for a while, and he's a young patient. I could do a crown on him, but I really want to stay conservative. He's in his mid-20s, but I see that he's going to lose a little bit of the cusp due to the decay. And it's very hard to do a direct restoration and maintain that interproximal contact. So I decided to do an onlay. And what I did was I cleaned out everything, and when we do an onlay preparation, what we want is a nice path of insertion. We want to make sure that the cavo surface margin is nice and rounded, and we just want to make sure that we have a good draw. So I scanned my preparation with the iTero, and I was able to take a look at the occlusogram, just recheck and make sure that the preparation was the way that I liked it. And once I was satisfied, I went ahead and sent it to our fast design. Now you can also use other scanners for your preparations. I sent it to the fast design and marked my margin. Very important that you see your margin. You want a good path of insertion, rounded internal line angles, have a nice deep chamfer. And the other thing that I like to check with our software is that path of insertion can be checked with a tool called milling and insertion. And it's a green toggle that you'll use. And if you see red, what that means is that path is not good. Anytime you see red, you want to move that toggle until you see green. Green means that you've got a nice path. That's very important because the last thing you want to do is mill out a restoration and there's no way for it to sit down. And I use the artificial restorative intelligence that's built into our software to do a proposal that took one click. I didn't have to do much to it. I think I just closed up the contact a little bit more on the distal lingual. And here's his restoration on number 30. We tried to take a good final picture on him, but he really did not want to stay. He wanted to leave. He did not want to come back. So this was his final, and he was very happy, and we were able to take care of him that same day. So with onlays, inlays, if your practice is taking insurance, these codes are important. Like I said, this is a ceramic-based restoration, so you can bill it out as a ceramic, and you'll bill it out the same day. That's the nice thing. Case number 2, this is Latonia. Her original inlay fractured, and the reason is that there was not enough clearance. So we want to make sure that our preparation design is good for the restoration. So I went in there and reshaped the preparation to make sure that the walls to the cavo surface margin were divergent and opened up that isthmus so that the restoration could sit down better. So you want to make sure you have good occlusal reduction. And I checked the occlusogram just to check and see where the contact points are with the rest of the tooth. And then it goes to the fast design, and I get my margin. And I have to tell you, the software design engineers have done such a great job. It marks the margin so quickly. Lately, I feel like I have only had to touch it a couple of times in a couple of areas. It's incredible. And then with the restorative proposal, again, I did not have to do much. Just clicked it. I noticed there's one spot that's going to be a little bit thin. I keep that in mind when I deliver. And I always use this tool, milling and insertion. Make sure that you see green. Make sure you have that path. Very important. I also like to check the area of the sprue. The sprue sometimes might be located in an area you don't want it to be. So with this case, it was a little bit close to the margin, and that little blue area means that you can move it up away from the margin. So you have that ability. So you have a lot of control with your restoration. That's the best part about the milling out your own restoration chair side. So from fast design, it's going to go straight to fast mill, and this is what it looks like in less than 10 minutes. I believe this case was 7 minutes. And when you get a restoration like this, this This is a score for you. This is a win-win for you, your patient, for your office. And I try in the restoration, make sure that it's passively seating down. I do not make any adjustments to the occlusal contacts until after it's seated. If you start making adjustments, because right now it's not bonded, it may cause it to fracture. So you want to be very careful not to make the adjustments right away. And once it's bonded, then I make my adjustments, make sure that everything is right. And LaTonya was very happy to receive her restoration same day. She's happy, I'm happy. All right, case number 3. This is my pandemic patient. He lost his onlia number 14 and did not have a chance to have it restored until 2 years later. So he dealt with this food trap for some time. And what happened was his gold tooth number 15 drifted forward and it closed that space. So again, I'm going to talk about path of insertion. We have to make sure if we're going to restore something that there has to be a clear path. So for him, I had to do some enamelplasty or guide plane number 15 to make sure that we could get a good margin so that our restoration sits down. And then we're also looking at the wall thickness. Make sure that the thickness of the wall is at least greater than 1.5 millimeters. I scratched up the tooth a little bit more to recheck and make sure that there was no cement left behind, and deep chamfer, rounded shoulder margin, always making sure that my margin is visible. And I do like to use a 2-chord technique. There is a 0-0 chord buried underneath the orange size 2. So the first chord is for apical deflection, and then the second chord is for lateral deflection. And then right before the scan, we take out the second chord and make sure that we capture the margin. And then when it goes to the design, we're marking our margin. You may or may not see a little something from our software that says that you have a slight undercut. If it's less than 0.1, I don't worry too much. That's something that I can work with. In this case, it's 0.05. If it's significant, if it's 0.1, then you have to really rethink your preparation. There's some sort of undercut that needs to be addressed. You might want to go back and make sure to check on the patient and maybe re-prep and re-scan, because undercuts can be a problem. And here is the restorative proposal. I just made sure that the contact on the distal was a little bit broader, make sure that he can eat food without getting a food trap there. And again, always check that path of insertion. And I also check where the location of the sprue is. You can check it without the quadrant or with the quadrant, and then it's nesting inside the block. And this is how it came out in less than, I think this one was less than 7 minutes. I do a passive try-in, seating down very nicely, and I went ahead and used the bonding protocol, and the case came out very nice. So here's Mark before and after, and I do like to take an x-ray just to verify the fit. Okay, this is case number 4. Tooth number 14 again, different patient. You know, we have a little saying, silver fillings eventually grow up to be crowns, but it doesn't have to be. We can still be conservative in this situation. And with Sterling, what we did was we removed the decay. There was quite a bit on the distal. You can see the hairline fracture lines on the mesial, the buccal, the occlusal table, and to the distal. So what I did was a form of a crown lay, an over, kind of a half crown. And you want to make sure the internal walls are divergent, but you also want to make sure that you can see your margin as you look to the occlusal. And this was the proposal. I didn't have to do much to get a nice design. And I just Check my contact parameters. Check that milling and insertion. Very important. And check the sprue. We want to make sure that sprue is not located in a contact area. Make sure that it's in an area that is not going to cause you to lose your contact. And this is how it looks intraorally. And after cementation, this is how it looks after. It's a nice service for the patient. And the reason why I didn't do a full coverage on him is he's actually a full mouth rehab. Eventually, he is going to need a full coverage crown, but this is going to get him by until he's ready. He has quite a bit of buccal recession. He does have on 19 and 20 below, and 21, those are BruxZir now crowns. So I'm going to quickly go over the bonding cementation protocol. Air abrasion, when you're milling in the office, air abrasion is very critical. You want to create that micromechanical retention that's going to occur with the restoration to the cement. Make sure that you clean it, make sure all the debris is out, and then you're going to use an adhesive inside the intaglio of the restoration, and then make sure it's super thin and light cure. Loading the cement, I want to show this because you do want to make sure that you have a fair amount of cement on your restoration before you plop it on the tooth. If you don't have enough, then you're going to have cement voids, and that can create a lot of sensitivity, and it's not good overall. So you want to make sure, I like to load it up at least 3/4. That way you get that nice cement squish. For the tooth, I like to use the full acid etch technique. And then I like to take this opportunity to desensitize the tooth. There are products out there, Gluma, G5. These all have a special ingredient called glutaraldehyde with heme that's going to help plug up those dentinal tubules that are exposed during dental treatment. Maybe you might have over-dried it. Maybe the acid etch just was too much. This is your opportunity to desensitize. I use this in my cementation protocol for everything that I do. And then you're going to use an adhesive. I'm not sure what happened there. It went back to same thing with your case. Okay, they're going to go back. Right after that. Okay, great. Very good. Thank you. Okay. So here's the cement, acid etch, adhesive, and then we're going to plop that restoration on top. We want to see the cement squish. If you don't see it, that's a problem. You want to tack cure. Now, everyone's light cure is a little bit different. The setting might be stronger or less unless you've calibrated. So I caution you when you tack cure, don't go the full 2 seconds that they recommend. I would just do a blip and then check it, because if you over cure the restoration, you're gonna have a tough time removing it. This is the part that nobody likes. I don't like it. That's why a lot of us don't like to bond our restorations. So tack cure, split second, just check it, and then go in there and start removing before it really starts to set. A lot of these dual cure, it takes about a full 6 minutes for it to completely set, but you're working against time. If you don't like working against time, there are other cements available. You can use a light cure only cement. There are companies that make that, but you want to be careful. So here is the protocol for camouflage now. With the restoration, make sure you air braid. Very important to get that micro mechanical retention, and you try in, you clean, whatever you use to clean, alcohol wipe or IvoClean. Make sure that there's no debris on there. Adhesive bond. When you use adhesive and cements, you want to use the same material from the same company. These companies make their bonding agents to work with their cements. So if you're going to use Reliex, you want to use the Scotch Bond. And then with the tooth portion, just think it's just like when we're doing a composite. It's the same protocol like when we're doing a composite. You want to acid etch, rinse and dry, leave the dentin moist. Don't over dry it, don't desiccate it, because that's what's going to create that postoperative sensitivity, desensitize, and then the same bonding agent. Troubleshooting dental pearls. I like to use these products for the removing of the sprue. The BruxZir polishing kit is great. It cuts through the zirconia, it cuts through the sprue very nicely, and then you can finish and polish. And you can use it for other restorative options. You can use it for zirconia, you can use it for PFM, gold crowns. And then on the far right, these are my favorite. This is how the magic happens, in my opinion. The Soflex finishing discs are great at finishing and polishing flashes. If your inlay, onlay has a little extra cement that's very difficult to remove, these are great. And then also when you're cementing, it's very important to isolate and keep the area nice and dry. If for some reason the cement sets inapproximately, there is a seri saw that you can use to gently whittle away at that area. It works, it's very effective, you just have to be very, very careful. The cutting edge is just the incisal edge of that seri saw. And then you can check with floss and floss threader. Every now and then I will break out the Cavitron if necessary, but these are the things that I like to use. And quickly, the strength is very similar to tooth structure, 193, best survival rate and cementation performance. There's a study that shows that the first year of placing Camouflage Now has a 98% survival rate. That's incredible. Easy to finish, high gloss retention, color stable, and ideal for inlays, onlays, veneers, full coverage, a lot of options. So this is Camouflage Now, the ultimate same-day restoration that makes conservative dentistry best for you and your patient. It's everything that you want it to be in less than 10 minutes. Thank you very much.